Hey everyone, Charlie Johnson, physical therapist. I've talked in the past about some of the issues that happen in people who have disc herniations, okay? So if you're watching this video, you've been diagnosed with a disc herniation and/or you have sort of like in my past videos, 7 telltale signs of disc herniations. You have pain that is much worse when you are bending or lifting. Maybe that's actually how you hurt yourself. You were kind of bent and twisted, doing whatever. Let's just say that you've been diagnosed with a disc herniation and/or you have pain when sitting, bending, lifting, but you have very minimal pain, okay, when you're standing or walking, okay? If you look around the internet, you'll see that this whole cobra thing, if you're a yoga fan, and/or this press up where you're actually like on your belly kind of pressing up, that's kind of the recommended exercise for disc herniations, and it usually is a good one in most cases, okay? So I do advocate that for most people, but not for everyone, okay? But here is why that works. So I'll help you understand what could be going on and why that's successful, and kind of help you understand how to treat yourself, all right? So on this left side here, I have a plus sign, okay? On the top, I have F for forward, so this basically correlates to some different movements in the spine. So the F is for forward, basically you're bending down, touching your toes. B is for backwards, your hands are on your hips, you're arching backwards. Left is you are tilting to the left, and right, you're tilting to the right, okay? And then this over here, kind of this like little circular like thing, is basically my rendition of like a disc. So the discs are cushions between the spine. Pull that out and kind of like put it up on the board, right? It's got these kind of like wicker weave of fibers around the outside, and then on the inside there's this jelly-like material, okay? So here is usually what happens, okay? So somebody, like a classic presentation of somebody who has a disc herniation is that they don't like sitting, they don't like bending. We talked about in a previous video how when you're sitting or bending, you put pressure on the front of the disc, which causes the material to move backwards, okay? But what we also see is that they lose their ability to kind of arch their back as well, all right? So let's see, this is a good color. So if you're standing there right now and you're not in severe pain, don't do this if you have severe pain, just watch, okay? But understand the idea, okay? So here's what we would see. If you were to go to touch your toes, you would have some irritation, okay? So if this is 100% ability to touch your toes, this would be about 50% of your motion, okay? So you can go halfway down, but you get some tension in the back of the leg, and the back starts to bother you, okay? Why? You're putting pressure on the front of the disc, which may be causing some irritation on the back of the disc, okay? But then what we see is that you have a significant loss, okay, of your ability to bend backwards. And as you bend backwards, you may say, oh, that's really, really stiff, okay? This is like a typical drawing of someone who has an issue with a disc in their back, okay? They have pain, usually central, and it may creep down into the thigh, may or may not, sometimes even all the way down to the foot in more severe cases. But we'll see that as people arch backwards, oh, they're really, really stiff into the backwards bend, okay? And then as they tilt to the side of the leg symptoms, all right, they are also very stiff. As they tilt away, okay, they have not much of an issue, okay? So the movement loss is kind of, in the front, but a lot of it's centered in this back kind of left quadrant, right? So kind of now take this to what's going on with the disc and apply it, right? So what we see is that would indicate that the lesion on the disc or the issue in the spine is somewhere on this side, okay? So there's kind of like your disc material, all right? Because it makes sense, right? If you're going to go try to bend your back here or here, you're going to be kind of trying to close down or kink down on this area, all right? Which is going to cause pain or problems, okay? Now, what keeps most people from healing, all right, and why we advocate sort of that press up is that most people avoid this because they say, oh, that kind of hurts, I don't want to go there, okay? Well, it hurts and you kind of don't want to go there, but you kind of have to sometimes, all right? Not in every case. If you're in pain right now, go see your local PT. If you're in the area of Royersford, Pennsylvania, give me a call. But the point is that so most people, they say like, oh, I hate sitting, I hate bending, and I feel better when I stand or when I walk, okay? And what's happening is when you stand or you walk, number one, you're taking pressure off the front of the disc, so you're more evenly loading the disc, okay? But number two, the reasons the press-ups work and being in an upright position of your spine works, okay, is because when you repeatedly extend, okay, so the next thing I would assess is I'd say, okay, go ahead, do your back bends, and they'd say, oh, it's stiff, it's stiff. And I'd say, okay, keep going, we're going to do 10 of them, okay? Oh, as I do it, 5, 6, 7, 8, 9, 10. They almost fully restore their ability to bend their back, okay? And oftentimes what they'll say is wow, my leg pain is actually much better, but I'm having some intense pain in the buttock, okay? So that's a good sign. I'll get into it in another video, but the pain actually moves closer up towards the spine, okay? And they actually restore their ability to move into that restricted motion, okay? So then the thought is, and it hasn't been completely proven, okay, but it makes sense to explain it this way. The thought is that what happened is as we repeatedly extended, right, if you wanted to kick this back to the center, okay, what would you do? You'd repeatedly kind of go from the back to the front to kind of like direct this and help reduce this issue, right? So then you have less of a restriction to that backward bend, as you do this press-ups or as you do the standing kind of back bends, and you start to feel better because you take the pressure off the pressure-sensitive areas and pain-sensitive areas in the back of the disc and or on the nerve, okay? So that's kind of what's going on. You may notice also, like another example, if you have, in 10% of the cases, we'll see that an issue with the disc will actually be kind of directly to the side, okay? In that case, bending forward and back is going to be painful, all right? And what you'll see in these people is that they'll be shifted directly away from the side of the disc issue, okay? So in a case like this where the disc is kind of herniated or off to the left, okay, some of the material, this person will stand like this. The treatment is that we have to correct that and actually get them over to that side of the restriction, all right? But yeah, they just kind of stay in this position because number one, you don't know any better, and that's our job, okay? Number two, it's painful, okay? So that's a little bit about why disc issues cause some obstruction of movement and why the whole prone press up kind of cobra idea may work.